that the reason you have gout is that it's your fault? My name is Dr. Arinola Dada. I've been a rheumatologist for the last 20 years. And one of the things that I'm telling you right now, if you have gout, is that it is not your fault. It is in the genes. In the last decade, there has been more and more research that has really been pointing out certain genes that increase one's risk of getting gout. So gout is caused by a buildup of uric acid. So uric acid is a byproduct of protein, the way our body metabolizes things. And this uric acid is sometimes difficult to get rid of. Due to your genes, it may determine how well your kidneys can get rid of uric acid. In fact, some genes determine if you're one of those people that hold on to uric acid instead of getting rid of it. So the way that works is that, if you think about the kidneys as like a funnel, and then there's this long pipe. And so what happens is everything gets dumped into the funnel to make your urine. Everything gets dumped into your funnel, and then your body starts to pull out what it wants. And so your body says, you know what, this person is low on sodium. Let's keep sodium in. We don't want to pee out the sodium. But he said, hey, we're a little dehydrated. Let's keep the water. But for some people, the body says, hey, you know what? I think I'm going to hold on to that uric acid, even though I'm not going to really do anything with it. So those are kind of the things, the genetics, DNA is what makes it harder sometimes for the body to get rid of uric acid. So does diet matter? The answer is yes. But diet is responsible for 10%. So I tell my patients no shellfish, no organ meats, avoid the high fructose corn syrup, and avoid beer. Those are the big things, but otherwise, we want to try to maintain a healthy diet. Now, some people maybe more prone to diet changes than others. For instance, when I worked at the VA, I tell people when I worked at the VA, Monday morning was gout clinic because during the weekend, our vets will go do some shrimping and clamming and wash it down with beer. And that dramatic rise in uric acid would cause gout attacks. Now, there are certain things that you can do. Of course, there are medications that can treat gout, which is good, but there are also things that you can do to kind of make sure you minimize your risk for getting attacks. So number one is avoiding obviously high fructose corn syrup, but the other thing is keeping your weight under control because it's been found that people with gout are more likely to also have high blood pressure, high BMI. So your basic body your weight basically can affect whether you get gout or not. Also, whether you have diabetes, all those things can affect, this metabolic syndrome that we're talking about, that people talk about. And we can talk about that next video. But at this point, the important thing to know is that if you're trying to maintain your weight at a good weight, your blood pressure is controlled, your blood sugars are controlled, those things make it less likely that you have gout. And if you do have gout, make it more likely that your gout is under control. So my name is Dr. Dada. I just wanted to let you know that, hey, there may be additional factors. And what can you do? Hydration is important. If you have gout, see your doctor. If you start getting attacks of gout, it's easier to treat it early than later. And just because there are times when you have a gout attack and then you don't have anything for a while, it doesn't mean the gout is gone. It just means it's silently accumulating. And then you get another attack 3 months later and you're like, oh, what did I do? Did it rain today? No, it's not because of the rain. It's because the uric acid has been accumulating and then one day you get an attack. So my name is Dr. Dada. Like us, follow us on our channel for more hints that will be helpful for you. And anyone that you love, share it with them. And if you're in the greater Seattle area, come visit us at Overlake Arthritis. We have a team of specialists there to help you. You take good care and have a great day.